A new patient was admitted to the ward. Her husband, in order to take care of her, had to stay by her side while holding their 6-month-old baby. On the first night, the patient was still in good spirits, chatting and laughing with Amy, but on the second night, she became disoriented, unable to even say her daughter's name. Amy asked her to squeeze her finger, but the patient had no strength at all, and her pupils were unfocused. Amy immediately called for the patient's husband. At that moment, a colleague handed Amy the patient's lab results. A few hours later, the patient died despite rescue efforts. At that moment, Amy began to suspect that Charlie was the one who killed both patients. The next day, the investigators returned, rekindling Amy's doubts. They asked if Charlie had been on duty at the time. Amy quickly denied it. The investigators explained that Charlie had worked at 9 different hospitals, but not a single one was willing to cooperate with them. The only reason hospitals would act this way, they said, was if they had already discovered problems and were deliberately avoiding the investigation. Their words struck a chord with Amy. She then arranged to meet with a former colleague, someone who had worked with Charlie at his previous hospital. When Amy mentioned Charlie's name, the colleague said there had always been rumors about him. Allegedly, one patient's death was his responsibility, caused by a medication overdose. They had found insulin in the patient's IV bag, and several other IV bags in storage already showed needle punctures. Charlie must have tampered with them before the bags were taken out for use. Amy couldn't help but suspect Charlie. She rushed back to the hospital storage room to check the IV bags. And just as her former colleague had said, she really did find several bags that had been pierced.